Hi everybody, Dr. Sherwin here from Artistic Dental Studio. I'm very happy I have a chance to talk to you about dental implant treatment. And I'm going to do this in the next 4 videos. I've divided this into 4 different phases, and the title of all these videos will be Dental Implant in Simple Language, so you can easily understand what it entails. The 4 phases actually consist of pre-treatment phase, surgical phase, restorative phase, and maintenance phase. I have divided it into these 4 categories so I can cover the essential points that everyone needs to know before embarking on such treatment. So let's jump in. On pre-treatment phase, you obviously need to have a consultation with your implant dentist. Implant treatment is a multidisciplinary treatment. What I mean by that is that the treatment is normally done by a collaboration between surgeon and restorative dentist. The treatment plan is determined after all data is gathered and discussed with patient, which actually constitutes this pre-treatment phase. Both surgeon and restorative dentist need to come to a conclusion on what the best solution could be for any individual case. In many cases, the clinician takes care of both surgical and restorative phase, and no third party is involved. No matter how many people are involved, pre-treatment phase, or we call it diagnostic phase, is divided into 2 or 3 separate appointments.
Appointment number 1 is when your dentist tries to get as much information as possible, which normally consists of having a chat about your chief complaint and also your goals,
doing a thorough examination, taking photos and x-rays. They also need to have some scans from your jaws, because scans or cone beam CT scans, or CBCTs as we call them, actually show the thickness and topography of the bone in the area planned for implant treatment. The scan script will be given to you on first session. The next thing they would need actually are some models from your teeth. They would either need to take some impressions or take some intraoral scans if everything is being done digitally. Your models will be used to make a prototype, of your future tooth, either virtually or out of wax to show you on second session. On appointment number 2, or second consultation session, dentist needs to have a chat with you about possible options, and the options could vary between individuals depending on the amount of bone in the area, the number of teeth being replaced, your systemic conditions, the quality of your bone, and many other factors. So implant treatment is not like one size fits all thing. There are many different modalities, many different variations, and once the best combination is found by dentists, then they will let you know about the pros and cons, risks and limitations for any given situation. Moreover, in any tooth loss situation, there could be other options as well, like fixed dental bridges or even dentures. So you need to weigh your options, have a comprehensive chat about all ins and outs of each option so you can reach an informed decision to whether you want to go for implant treatment or not. Normally, on this second consultation, you and your dentist could come to an agreement on what needs to be done, and you will be booked for your next session, which normally will be your surgical phase or implant placement session. In some cases, especially like full mouth rehabilitation cases, or possibly some aesthetically challenging cases, some more complicated cases, there may be a need for a third consultation as well. Another thing that could be done between the first and second consultation could be a prototype in the form of a model, which is a wax up, or a virtual smile simulation or digital smile design, which could help you visualize the final outcome before starting the treatment. So with the whole thing in place, you can get a good idea how much it would cost, how long it would take, what steps you need to follow, and so on and so forth. And also what you need to do after the treatment. That's a very important part. The aim of the first phase of implant treatment, which is the diagnostics, as I said, is to match patient expectations with what we could reasonably achieve. Alright guys, I hope this video could have helped you with the first phase, and next time I will have a chat with you about second or surgical phase. Thank you very much. Have a good day, and please put your comments down below. Ask any questions you may have. I will be more than happy to help you with them. Have a good one, and goodbye.